Hi, I am a cardiac ICU pharmacist, and let's talk about statins. Statins are a class of drug that are used to reduce cholesterol levels by inhibiting a key part in cholesterol biosynthesis, and this is HMG coenzyme A, and it competitively inhibits this enzyme in order to reduce the amounts of cholesterol in your body. You can see here through this picture that when you inhibit this enzyme, it inhibits the further downstream production of cholesterol, which is down here. And an important way to distinguish between the different statins is the intensity of them. So it's split up between high intensity, moderate intensity, and low intensity. And you can see why we use atorvastatin and rosuvastatin in our patients that are high risk, like if they've had a MI or stroke, because they are the only drugs that are capable of achieving that high intensity statin effect. Also, what's important to note is that the dose cutoffs. So you have rosuvastatin 20 milligrams and atorvastatin 40 milligrams. Those are the cutoffs for high intensity when you use atorvastatin or rosuvastatin. You can use atorvastatin and rosuvastatin at lower doses, but then you go into the moderate intensity category, which is 5 to 10 milligrams for rosuvastatin and 10 to 20 milligrams for atorvastatin. Another distinguishing factor between high, moderate, and low intensity statins is the ability for it to reduce LDL. So you can see that high intensity statins have the ability to reduce LDL by greater than 50%. And then moderate is 30 to 49%, and low intensity is lowering LDL less than 30%. And the LDL goal that we target in patients really depends on that specific patient. And an important subpopulation of patients that are on these drugs have clinical ASCVD right here on the top, and that stands for atherosclerotic cardiovascular disease. And this means that if you have clinical ASCVD, that you have had either a stroke, a heart attack, a TIA, if you have peripheral artery disease, aortic aneurysms, anything that is atherosclerotic of that nature, you are considered to have clinical ASCVD, and then you would follow this pathway that is published by the American Heart Association on what drug you should be initiated on and what target LDL you should have. And what your goal is depends on whether or not you're at very high risk or not at very high risk. And if you're not at very high risk, then you follow this pathway over here, and it's split up between your age, if you're less than or greater than 75. And if you're less than 75, then we want to reduce your LDL goals by 50% or greater using a high intensity statin. And if you can't tolerate it, then we can use a moderate intensity statin. And if you're on your max tolerated dose and you still haven't achieved an LDL of 7, and that was just from the American Heart Association. There are other societies like the European Society of Cardiology that have different goals based on different risk factors. Just know that it is very nuanced and very different for each individualized patient. So speak to a cardiologist about what your LDL goals should be. Another important thing to mention about statins is that there is a great deal of primary literature that shows their benefit in certain disease states. We're talking reduction in cardiac events, reduction in stroke, and even mortality benefits in certain patients. Let me know in the comments if you have any questions about anything that was discussed in this video.